Okay, I think we'll get started. Jason, are you good to go? I will get started off.
Yeah.
Perfect. Well, hi everyone. Welcome and thank you for joining us today for our webinar on virtual care. We'll start with just a few housekeeping items. Paula, if you can please go to the next slide. Thank you. So just note a few things for this event today. First off, you are muted by default and you actually aren't able to unmute yourself. So if you have any questions throughout the event, we invite you to use the chat or the Q&A function that you see on the right-hand side of your screen. And we'll either answer the questions throughout the presentation on the chat, or we can just save some time at the end and answer them with Jason, who is here today with us to present virtual care. Please note that the webinar is recorded, so we'll make the recording available after the fact if you ever want to consult it or share it with others. And lastly, before we get started, we do appreciate your feedback. So at the end of the event, when it closes, you'll have a few questions. We'd appreciate if you can take the time to fill it out and give us your feedback. It will take no more than 2 minutes, I promise. So let's get started. We'll go to the next slide, please. So today we'll talk to you about virtual care. So TELUS Health Virtual Care and our LifeJourney solution. So I'll do a bit of an introduction and talk about why we're here. And then Jason Hyde, my colleague who is on our virtual care team as well, will tell you more about TELUS Health Virtual Care and TELUS Health LifeJourney, and then we'll save some time for your questions. We've allotted an hour for this presentation. I don't think it'll take that long, but we're here to answer your questions, so we have as long as we need. Okay, next slide, please. Okay, so why are we here? Well, it's no secret that the last 2 years have been a challenge in more ways than one. So we've all been making our way through all those different challenges. But we know that for small and medium businesses, it's also meant that, focusing on the health of yourself and your employees has become even more challenging than before. So in fact, at the beginning of the pandemic, a study found that 45% of business owners said they experienced psychological health issues due to COVID, and 43% of business owners were working significantly more hours than before. So now, fast forward 2 years later, business owners are still facing, some obstacles, and there's always evolving challenges. So now we're looking at going back to work, but we're also faced with, I think it's the 6th wave at this point, but it's just becoming a challenge to keep up with which wave we're in and what that means for ourselves, our families, and our team members. So at TELUS, we're always looking for ways to support our communities. So we do that through things like our Days of Giving every year, through the TELUS Friendly Future Foundation, but we're also doing it by giving you and your employees free access to our virtual care service, which is called TELUS Health Virtual Care. So hopefully you're all aware of this promotion that we're doing. So it's not really a promotion, but it's really adding virtual care for you and your employees who are on your business mobility plan, so that you, your employees, and their families have access to virtual care 24/7. So what we want to do today is tell you more about this virtual care platform, how it works, how you can use it, and how it can support you as a business owners to in turn support your employees and their families so that everyone can prioritize the health and well-being. So as I mentioned, just note that currently the service is available to all your employees who are on your mobility plan. But you do have the opportunity to offer the service and extend the opportunity to all of your employees. So we'll tell you more about that, but first I'll hand it over to Jason to talk more about what is virtual care, what our service is, and how it works. Over to you, Jason.
Thank you, Marianne. We'll just go to the slide. So what is virtual care? Go to the next slide there, please. So a lot of folks really see TELUS as, fun little critters on TV and just mobility, but TELUS Health is actually a really big part of the TELUS family. And we're really committed to transforming healthcare, and we are investing a lot of money in our virtual care services. So with all the partnerships that we have, we're continuing to increase that over time. If you look at some of the stats here, we have 4 million Canadians that have access to our virtual care platform right now. We currently have over 30,000 physicians and EMRs nationally, and over 66,000 partners in allied health. So we're continually growing that so we can have a greater continuity of care. So, some things here to notice is, We have, 4 hospitals. We work with many insurers across Canada to help with the benefits payment processing and the back end, for a dentist office. You might notice that you see TELUS on your payment slips, or when you're looking at the actual computer that the dentist is using, you see the TELUS logo on it. We have wellness centers across the country. We have a virtual pharmacy that we've launched across the country recently, which, you can get medication directly delivered to your home. You don't have to go to your pharmacy to actually get it. We have mobile clinics, that you might have seen them on TV or around some of the local communities. And, we have, 16 million TELUS subscriber connections, whether it be through mobility, whether through internet, but providing healthcare through all these different outlets. So definitely TELUS is more than just cell phones and critters. Next slide, please. So, some of the things that we ask our clients is, what's keeping them up at night. And what we've heard most is, COVID, return to work, new challenges, mental health, absenteeism. So these are just kind of some of the market trends that we're seeing when it comes to return to the workplace, recruitment and retention, employee stress, and the absenteeism. So these numbers, fluctuate from different days, whether it be, beginning of January or end of 2020, but the numbers are there, and this is why we've offered our virtual healthcare solutions to employers to help with these particular things in the market. So can you move to the next slide, please? So this is just a journey that you'd see with an employee or patient using virtual healthcare versus going in person. So when you look at it from an employer perspective, you're looking at the amount of days and times that the employee is missing work, where, you'd have to maybe, substitute them with somebody else or replace them with their hours. Virtual healthcare is much easier because that person can, that visitation can go down from 1 to 3 days to under 2 hours. So it's really a benefit. And on the employee side, the employee doesn't necessarily have to miss work. If the employee can work remotely, they can still be home and work, and also have the virtual care offering for them and their family. So it's really important when you look at this as a journey, right? If you're taking the transit or driving or going to an office and sitting and waiting to see a doctor, and then, by the time you do that, and you have to get your prescription and then go pick a prescription, try and, go back home or go to work, that could, you could say the whole day is gone. With the virtual care, you really log in, you get access to care right away, and, there's somebody there to speak to help you with whatever your concerns may be. And this is what's included right now with the offering with your mobility plan. And we can kind of go to the next slide. And this is a bit more in detail. So with the virtual healthcare, you have an application on your phone, or you could have it on your laptop or desktop computer. And you have 24 hours a day access, 7 days a week. Coverage is nationally, so it doesn't matter what province the user is in, they'd be able to use it. And it's available in English and French, and there's more languages coming soon. It is also tied into our health records. So if you wanted your doctor to receive any communication from your virtual care visit with us, it can be sent to your doctor electronically. It does not have to be, but if you'd like it to be, then it definitely can be. So the support is not just for your employee, their spouse or dependents are also able to have the service. So it depending on their age, they can either have their own login, but for younger children, they have to go through their parents to get access to it. But it is available as long as you're in the same household. And what it is we have more of a human approach. So you might have heard of, many different virtual care services, but ours is a care advocate, which would be, as you can see on the picture there, there's always somebody there to speak with you. And that person is the care advocate that kind of talks to you, understands what's going on, and they from that point will connect you with a nurse practitioner or MD or what's needed at the time. The care advocate is always there, and they're the first point of contact when you do an intake session. Some of the things that you can do on the virtual care platform, you can get prescriptions, diagnosis, you can get lab requests, referrals if you just need advice. They can send you for imaging. There is a mental health aspect as well too, where there's somebody available to speak to, and if they feel that you need to go see somebody or advise you to do go somewhere, they will do that for you, but they are available. And there's also, they can make specialist appointments for you. So a lot of the things that you can do at your family doctor, or you'd have to go into a walk-in clinic, can be done on the virtual care platform. So it's very convenient, as I said, when it comes to saving time, traveling, missing time at work. It's on demand, and it's always there. Next slide. So this is kind of to show you the journey if you haven't used the application already. This is kind of how you'd see it. So you have the on-demand consults, which, as I said, once you log in, there's somebody there always ready to speak with you. It's real-time text, so you'd log in, and if they're with a patient right now, they'd probably say you have to wait 30 seconds to a minute maybe. You don't have to be by the phone. The notification will pop up and the conversation will start, and you have that interaction with the care advocate. They might ask you to show pictures. Maybe you have a broken leg, or you've cut yourself, or you have a burn, something of the sort. They will ask you to take a picture so they can see it before they send it off to the nurse practitioner. The nurse practitioner at that point will have a secure video conversation with you, video chat, just to kind of see how you are, see if you needed more extensive help, or if they can just help you on the site. But they just want to see and make sure that you're okay and you're actually able to speak and talk to them and understand what's going on. And again, we save your health records, which is all it's all saved on a secure environment, and it can be transferred to your doctor if possible. Now, that being said, we don't necessarily have to do that, and your doctor does not get dinged for using this service, because this is actually private healthcare because it's provided by the employer. So your doctor does not need to know that you're using it if you have a concern with that, but the option to have your doctor get this information is always available. And what we also noticed too is that over 70% of our consults are done during the workday. So if you take that into consideration, that would be the amount of people that would be leaving to go to the doctor or go to a walk-in clinic or what be it to leave work. So from an employer standpoint, this is really to help keep your employees healthy and also keep them, at work, because they're not spending as much time trying to find healthcare. And some people don't have family doctors as it is right now. So trying to find appointments to go to the doctor is not always the easiest thing for them. To the next slide. This is the team of the care advocates that we have on the virtual care application, and it goes anywhere from some of these I've said, physician, nurse practitioners, nurses, psychiatrists, dermatologists, allied healthcare professionals, and pharmacists. So, we do have an extended team to help with our virtual care services to, again, keep that continuity of care and to make sure that we have all services on demand ready to go for your services. Okay, and to the next slide here. So right now, what is being offered with the for the small business team is our virtual care platform, and our virtual care platform of primary care is a portion of our what's called our LifeJourney solution. So our LifeJourney solution is an evolution of our EAP. So we launched a service last year, and we've had great results and feedback on this service. It's a digital employee and family assistance program solution. We've made many more integrations and enhancements since we launched the product last year. And today, just to go over a little bit of it, it's one front door experience, and it includes the primary care along with the employee assistance program, as I spoke about with this. So this is up and beyond what is on the virtual care platform with the small business solution, but primary care is one of the parts of it. We also have financial assistance. We have legal assistance, and we have what's called specialized digital therapy, which is a bit more of an advanced, say, from the mental health aspect of the primary care, where the care advocate would actually put the patient with a behavioral coach and a specialist to help with any of the certain treatments that they're looking to help the patient with, and it's all module based, and the employee can do it at their own pace. And again, they don't have to leave work to do this and go to appointments. They can do it at home. They can do it when they have free time. So it's really convenient. There's also nutritional counseling that's available, and something that we are actually launching in a couple of weeks, May 1st, is our Life Tools, which is it's a healthy, nutritional, well-balanced kind of application that tries to keep you more in shape. So if you want to, challenge yourself to eat better, if you want to challenge yourself to sleep better, exercise better, it's a full platform for wellness that helps as well to keep you healthy and not have to be using services to call in and be sick. So it's more proactive than it is reactive. But that will be included as of May 1st. Next slide. So to talk about the LifeJourney path, I should say, it's kind of the same as the virtual care. You'd have the intake assessment with the care advocate, and the care advocate would kind of look to see which service path you need to go on for care. So if it is, perhaps you need to speak to a financial assistant or legal assistant, they'll put you towards that path. If it's a nutritionist, they go toward that path. If it's mental health, that could turn into something else that you might need specialized digital therapy. They'll make sure that employee is put on that course right away, and that there's a plan built for them, and they don't feel that they're on their own or they don't have anybody to turn to. They're definitely taken care of right away. The number 4 there, as you can see, that personalized care path is what is put out for the employee. And it could be multiple things at the same time. It doesn't have to be just one treatment that they're looking at. So they could have mental health counseling, they could have the specialized therapy going on, and they can also have legal advice that they have. But it's all set up for them. It's all put into a calendar, and it's all up front where they can talk to their behavioral coach and help them through anything they need or any scheduling of the sort. And the continuity of care, again, even when the program is over, they reconnect to make sure that the patient is doing well. If they need anything else, they'll assess them or put them into a different program or start them over again if they need to. But the care is always there, so the patient is never left on their own, and they don't have to go find their own means of trying to feel better or get better. It's all continued care. So this here really helps even reduce absenteeism even more. Health and well-being is a very important topic right now, and there's a lot of leave due to stress and depression and anxiety, and this LifeJourney is really beneficial when it comes to the overall health and well-being of your employees. To the next slide. I think there was one that was missed out, but yeah, any questions at all? I mean, we've already explained the housekeeping. If there's any questions in the chat or anything I need to answer, please let me know.
Yep. Thanks, Jason. We don't have anything in the chat or the Q&A right now, but if you have any questions, feel free to type them in and we'll see them. Paula, if you see any that are sent directly to you, please just chime in and tell us. Just wanted to do a quick reminder. So as I mentioned in the beginning, for those of you who may have been a few minutes late, TELUS Health Virtual Care is currently included in your TELUS Mobility Plan. So you as the account owner and all your employees who are on that mobility plan currently have access to TELUS Health Virtual Care. So you would have gotten either an SMS and or an email with instructions to activate your account. So you can just do that. It takes a matter of a few minutes to activate your account, and then you'll have access to all the great things that that Jason just mentioned for the virtual care side of things. LifeJourney is a different program that you can add on to that for all your employees. So we'd be happy to tell you more about how that works. And additionally, you do have the option of adding virtual care to the employees who are not currently on your mobility plan. So we can do that as an additional feature. So happy to talk to you about that some more. We have a question, I believe, about this. Is this for corporate TELUS mobility clients only or personal TELUS customers as well? So this is for the small and medium business mobility plan. So right now it's only for the mobility, like the business mobility clients. The app is called TELUS Health Virtual Care. So you can download the TELUS Health Virtual Care app and create your account, or you can look for your email that was sent to you with instructions. I can also paste the link in this chat for everyone to have the link to activate your account, if that's helpful as well.
Just to top up on that there, so that personal TELUS customers, so if somebody's using a personal TELUS cell phone, but they're employed by one of the employers that have this program, the employer can extend this to that employee, but it is on the business side. It's not on the personal side when it comes to billing.
So I've just put the link in the chat for everyone to see. So if you follow that, you can actually activate your account. And if you share that link with your employees who are on the mobility plan, they can all activate their account and have access to it at no extra cost to you. Okay, we'll leave a couple of minutes for any other questions. You will be receiving a follow-up email for this with some more links that could be useful with information about virtual care. And if you have any questions, as I mentioned, we're around and happy to tell you more about the program. And on that note, I think that's it. Jason, anything to add to close it, or otherwise I think we can close this event.
Yeah, just the LifeJourney services are available on our website. So if you do go to TELUS.com and help, the LifeJourney page is there, so you can see how that works, and definitely reach out to our team if you want to add the service for your employees. It's a really great addition, and it's as I said, with our addition of Life Tools coming in May, it's a really great service to have for health and well-being.
Great. Well, thank you, Jason, and thank you all for attending. Have a great day.